Hello and welcome, and thank you for Zooming in this afternoon. It's really great to have all of you here. I am Ruth Katz, co-director of Aspen Ideas Health and executive director of the Health Medicine and Society program at the Aspen Institute. I'm delighted to welcome you to the first of many virtual programs brought to you by Aspen Ideas Health. Of course, under normal circumstances, we would be ramping up to host our annual 3-day Aspen Ideas Health event held annually on our Aspen campus in June. While we're disappointed that we won't be able to gather in person this summer, we also don't want to lose touch, especially when the need for focused, factual conversations about health, medicine, and science has never been greater. So today we are launching a series of virtual discussions, all designed to connect you with experts, innovators, scientists, practitioners, and advocates, leaders of all sorts, who will provide clear information and often visionary solutions to the many health challenges we are now facing. As I said, today is day one in our series, and we couldn't be more honored to kick off things by hosting Dr. Tom Frieden in conversation with Alison Kojak. We only have a short time together with Tom and Alison, so I won't take much of it with long introductions, and I'm sure you know a lot about both of them already. We certainly do. Both of our speakers are very good friends of the Aspen Institute. But briefly, Dr. Frieden is a physician trained in internal medicine, infectious diseases, public health, and epidemiology. He is the president and CEO of Resolve to Save Lives, a 5-year initiative of vital strategies whose goal is to save millions of lives from cardiovascular disease and make the world safer from epidemics. Previously, Dr. Frieden served as director of the CDC, the Centers for Disease Control and Prevention, as well as New York City Health Commissioner. Alison Kojak is U.S. investigations editor with the Associated Press, where she manages a team of investigative reporters and works with colleagues across the AP to do deep reporting that exposes wrongdoing and injustice and holds powerful organizations to account. We've known Alison also since her days working as a health policy correspondent at NPR. In addition to NPR, she has spent time at the Center for Public Integrity and Bloomberg News. Alison's work has been recognized with 3 Polk Awards, among many other honors. Thank you, Tom. Thank you, Alison, for joining us this afternoon. We know how incredibly busy you are, and we are most grateful for the generosity of your time and for your expertise.
Thank you so much, Ruth. And it's an honor to be here again, virtually at Aspen. And Dr. Frieden, thank you so much also for being here via Zoom. Obviously, we're all here via Zoom because of this global pandemic that we're facing. And so I would really like to start with the basics. You are the director of the Centers for Disease Control and Prevention. Well, I think we all know this pandemic is bigger than anything we've experienced. Is it in the realm of what you had imagined when it was your full-time job to imagine these kinds of things?
The pandemic is bad, and what we have to come to terms with is that it's just beginning. This is on the order of the 1918-1919 influenza pandemic. That's how bad it is. It is the worst health threat in 100 years. And we've seen from parts of the world like New York City, where I'm sitting today, just how bad it can get and how much worse it still could get. So this, to put it in perspective, in terms of a health event globally, the last one of this scope was 100 years ago. And to put it in perspective locally, in New York City, where I was born, where I have lived much of my life, I was health commissioner here, I started my career here, I did medical school here. Over the last week, things have begun to get better. We're not hearing sirens day and night. But up till today, more than 20,000 excess deaths in New York City, either from COVID or in the time of COVID from other conditions as well. Nearly 18,000 of them from COVID. To give you a sense, that is in 2 months, about 2/3 what the 1918 pandemic caused in this city in 2 years. So it's a terrible pandemic. And if the studies are right, that maybe 1 out of 5 or so New Yorkers have been infected, that still means that more than 5 million people are susceptible. And it could get 2 or 3 times worse here and many, many times worse anywhere it hasn't hit this hard yet.
So on the issue of whether it was something that should have been imagined, I mean, I think a lot of people would argue that the United States healthcare system and response system was not prepared. Was that a lack of imagination, or was there some other reason that we seem to have been caught a little bit flat-footed?
Well, first, I think any health system anywhere would be challenged by this, but we have seen countries be very proactive, much more proactive than this country has been over the past few months, especially countries that had dealt with SARS. Countries that had dealt with SARS knew that a coronavirus could be really difficult to deal with. Now, this is much more readily spread than SARS. It's spreading like a super SARS. It's not as deadly as SARS. SARS killed 10 or 11% of the people it infected. So that was much deadlier, but this spreads like flu. I said early on, the nightmare scenario would be a pathogen that spreads like flu and kills like SARS. And we're not quite there, but it does spread like flu and it kills many times more than most flus do.
Now, in just the past, I mean, we started seeing this virus in China in late December. It's now late April, so 4 months. And at least by the Johns Hopkins count, 300,000 people have died, probably far more. And you say we're just at the beginning. I'm not going to ask you how many people you think will die, but do you think that rate of spread, now that we've learned from what we've learned in the last 4 months, is likely to slow? Are we getting to the point where we'll be able to deal with this more?
We've learned an enormous amount in 4 months, and we're learning more literally every day about this virus and how to control it. The way I think of it is we have 2 main tools to deal with it. We have a very blunt tool, which is staying at home, physical distancing, shutting things down, and that works. It's effective. It takes a long time for it to work because the infection, about 5 days later, you get sick, up to 14 days later, you get sick, another 5 or 6 or 7 days before you're very sick, and for those who tragically die, another week or so before people die. So you're talking about 3 to 4 weeks from when it starts spreading to when you see people getting very sick and dying. And by the same token, if we all shelter in place, 3 or 4 weeks or 5 or 6 weeks until you see the levels of infection start to come down, or even longer if it's widespread in society, as it is here in New York City. So that's the blunt tool, and that works, but it also is a blunt tool that damages our economy. Then we have precision tools. We have things that work not as well, but they're important. Washing our hands, covering our mouths because there's asymptomatic spread. And critically, what we call the box it in strategy. Testing, isolation, contact tracing, and quarantine. These 4 things can put COVID in a box so we can come out more. And that's really important. And we need to get each of the 4 corners of that box working well, or when we come out, the risk is that it will come exploding back and we'll have to go back inside, damaging our economy and threatening to overwhelm our healthcare system. That's why it's so important that we use this time we're sheltering in place to ramp up our preparedness and to think about redesigning parts of society to engineer out the parts that could, the risks of COVID to the greatest extent possible.
Now, I smiled in the middle of that, and it may have seemed inappropriate, but I was more thinking when you were talking about sheltering in place that we're both talking to each other from our homes, which is, I think, probably where a lot of people are watching this. And that's, you got to this a little bit. The next question, when can people think that they may be able to leave their homes at least more readily? I think a lot of people are to some degree, but when would it be wise to ease those stay-at-home orders? You described the strategy that your organization, Resolve to Save Lives, has been promoting, this box-it-in strategy. Is it realistic that we can actually do that in a way that would bring people out to a point where they would be willing and feel safe eating at a restaurant?
there are a few things to be clear about. First is, as you say, it's about easing into it. It's a gradual resumption, step by step, so we don't get into big trouble and see a big explosion of cases. Second, sadly, for people who are older and who are medically vulnerable, it's going to be a question of staying separate for longer because they're more vulnerable. This is a particularly deadly disease for the elderly. And that means that nursing homes, as I said almost 2 months ago, are ground zero for this pandemic. And if we don't dramatically improve what we do, we will see over 100,000 deaths in nursing homes in this country in the next year. So coming out again means thinking of how to do things safely. And it's not about a date. There's kind of an obsession with, will it be this date or that date? It's about data. It's about, are we doing what we need to do to track the virus so we know where it's spreading? Are we doing what we need to do to strengthen healthcare so our doctors and nurses on the front lines don't get infected? They should not have to risk their lives to take care of us. And are we implementing that box it in strategy so we can test, isolate, contact, trace, and quarantine? And are we restructuring society in ways that are just going to be things that we have to live with? For example, mandatory hand sanitizer at the entrance of buildings, using face masks when out in public, making sure that when people are ill, they don't go out, understanding that there's a societal benefit for different things. And if it's about restarting daycares or critical infrastructure, or critical businesses, or businesses that are crucial to a community, that's something that we need to figure out how to do as soon and safely as possible. But there are other activities that we're going to have to wait on. My mother, who's 90, was in 2 choirs, and she loved singing in choir. That's not going to come back anytime soon.
Right. And you mentioned dates, and I think the reason, the reason a lot of people are obsessed with the date is schools. My son is scheduled to start college in August, and there's a big question about whether that's even possible. A lot of parents are wondering if their children will ever go back to school, because how can you go back to work if your children aren't in school? And so my question, I guess, especially for younger children, even if people are told to practice some level of social distancing, how can you get 7-year-olds to not, grab each other and kick each other and play or try to play ball together? Or does that have to be what it is? Can we get beyond that?
There are some things that we can do. And I think one of the most important things that we have yet to learn about this virus is how often it is spread from children. We know with influenza, kids are important in spreading the virus. And if we close schools for months during an influenza pandemic, we really tamp down spread by a lot, 20 to 40%. But we have no data that would suggest that that's what's going to happen here. So we need to learn that. Kids don't often get severely ill from this. One way to reopen would be to start with daycare or K through 6 or K through 8, and to have safer schools, to make sure that kids who have medical conditions and staff who are older or who have medical conditions are going to have to stay out for a while. But for those other individuals, that may be a way to restart. There's an interesting photograph I just tweeted out today from China of kids in school with kind of hats on with long posts to either side to keep them kind of rolls, cardboard rolls to either side, to remind them not to be near others.
I just like to see that.
And I think we need to learn from everywhere in the world, what are design solutions, what are engineering solutions to reduce risk so we can get back to as much of normal as we can and prioritize societal benefits. Daycares are really important so parents can work.
So one of the big challenges up until now in dealing with this virus overall has been the problem of access to adequate testing. And central to your box it in strategy is a lot of tests being available. Last week, the White House put out sort of a blueprint on testing, and they suggested that about they would help states test about 2% of their populations each month. I know that we have talked about this a little bit, and you said that may not be enough. how much testing, and do you foresee there being enough tests available soon that the situation, the box it in strategy you're describing can be feasible?
We are seeing a steady increase in test capacity, but the math here is unforgiving. If you just test everyone with symptoms of COVID, healthcare workers with symptoms, people who are seriously ill, people in congregate facilities like nursing homes, you're at more than that number. And that's not even taking into account the lower priority tests that need to be done that we would like to have done. So we do need to scale up test capacity, but we don't need to wait for test capacity to do lots of other things. Testing, isolation, contact tracing, quarantine, all of those things go together. And the more we do the other three sides of that box, the less need there will be for testing, because we won't have so many outbreaks. We won't have so many cases and contacts. We won't have so many outbreaks in homeless shelters and nursing homes and correctional facilities. That's the key. We can't think of this as there's one fix. This is a virus with trillions of viral particles around the world, spreading to 200 countries, with millions of people having been infected. And we're just at the beginning. So if we want to deal with this well, we need a comprehensive strategy. That strategy means we protect healthcare, we strengthen public health, we redesign parts of society so we can reopen and resume and recover as quickly as possible without a rebound in cases.
Okay. So you talk about having a well-defined strategy, but a lot of people would think that should come from the Centers for Disease Control. And unfortunately, it seems that they have been at least shushed, if not silenced, an organization that normally would have a central role here. What has happened to the CDC, and what do you think, what are the consequences?
I'm not sure if there's a difference between being shushed and being silenced. We haven't been hearing.
When I shush my children, they don't always end up silent.
But we haven't been hearing from the CDC. And I personally would feel safer if we were hearing regularly from people like Dr. Anne Schuchat, Dr. Nancy Messonnier. These are folks who have spent their entire careers fighting viral respiratory infections. And if I were running the CDC, I wouldn't take a step without consulting with them, learning from them, being guided by them. They are our country's and the world's top experts in this. That doesn't mean they have all the answers. No one has all of the answers, but they can help us understand what's happening and do as well as we can to reduce the illness, the death, and the economic disruption this is causing. One interesting fact, the American people continue to trust CDC. We know that for many reasons, opinion polls, but also because they vote with their clicks. There have been more than 1.2 billion visits to the CDC website about coronavirus specifically. And it's still the best place to go for information, advice, guidance, recommendations to protect you, your family, your workplace, your school, any facility you can think of.
Do you think, though, that the strategy that the White House has put in place, which is each state should figure out what is best for its state in terms of response and reopening or shutting down various things, makes sense? I mean, New York is quite different than Wyoming, which is quite different from Texas. Or would it be better to have one central guideline? Generally,
what works best is a national approach with guidance, procedures, protocols, indicators, accountability, resources, tools, all of that from the federal government, and then implementation at the state, city, and local levels. That's an important and reasonable partnership.
Okay, so we have some questions from our viewers. One is, this presumes that we have now had a tamping down of the virus, which I think is generally accepted. How likely is it that we're going to have a resurgence in the fall, and are we prepared for it?
Well, the bad news is we may not have to wait for the fall. As soon as we keep coming, as soon as we get back out, the virus is still circulating, and we could see a big increase in cases. We don't know how it's going to behave over the summer in warmer months. Maybe there will be a lull, maybe it'll fizzle out, but we can't count on that.
That seems to be a common conception. I don't want to say misconception. So is there any reason to think that somehow it will lessen in the summer?
Many respiratory viruses are less common in the summer. Remember, there are 7 coronaviruses that affect people that we know of. 4 cause the common cold. They're about 20 to 30% of common cold infections. Then there's SARS and MERS, and now COVID. For the 4 common cold infections, one of them has a winter peak and a summer peak. So this is a new virus. No one can predict with certainty what's going to happen in the future. If someone tells you with confidence they know what's going to happen, then they don't know enough about this virus.
Okay. Another question, and we're going overseas now. Some other countries, such as Sweden, are pursuing a, quote, herd immunity approach. What lessons are we learning from their strategy?
The book has not yet been written on this, and I think Sweden has very much denied that it's approaching a herd immunity status. Let's be clear, as an epidemiologist, let me tell you in no uncertain terms what, quote unquote, pursuing a herd immunity status would look like in the US and globally. It would be more than 1 million dead Americans and more than 10 million people dead globally. That's what waiting for herd immunity would mean. But I think what Sweden is trying is, can we continue a lot of social activities while we try public health activities and not have such a big problem? If you look at the actual death rates from Sweden compared to their other countries, their death rate is much higher. So I think it's very premature to talk about the Sweden being a success story here. We'll have to see what happens and what that brings. They haven't seen explosive increases in cases, but they've seen a steady increase in deaths, many times higher than their neighboring countries.
So that's one strategy. A different strategy that people have been citing as a success has been South Korea. It's clearly a much more top-down centralized government approach. Can you talk a little bit about where they've had success that we have not?
There are countries around the world that have responded very effectively. South Korea, kind of ironically, because they had a very large outbreak initially, they had full warning that this was coming. Whereas in New York, for example, it was spreading widely before it was apparent that it was spreading. But Korea had a coordinated national approach. They had begun scaling up testing in January. The US federal government began in March. They had begun with intensive contact tracing back in January, February. They had had a public health response that guided their national response. And that's one of the keys to effective response, whether it's in parts of China outside of Hubei, where they were able to prevent explosive spread, whether it's been in Singapore, where now they're dealing with a big increase in migrant workers, but still relatively well controlled in the rest of the society there. At Resolve to Save Lives, we work intensively with many countries in Africa, and we're seeing now several things that are really quite important. Better understanding of the need for physical distancing than we see in many other parts of the world. Better practices in contact tracing and public health than we see in many parts of the world, but also more risk of running out of food, of violence, of social unrest.
Now, those first 2 points you mentioned, is that mostly because they are more accustomed to having outbreaks of infectious disease?
I think so. Liberia, which had, of course, a terrible Ebola outbreak, rapidly hired 6,000 contact tracers for a relatively small population.
Okay. And then you mentioned the risk, much greater risk of sort of a stay-at-home order like we're all living in. You know, I can get food delivered to my doorstep here. How big of a problem is that in countries like Liberia?
I think each community needs to find the balance for how can you loosen the faucet enough to allow those essential societal and economic activities to occur, but not so much that you end up with an explosion of cases. And one of the key concepts there is shielding and sheltering the vulnerable. People who have underlying health conditions, the elderly, are crucially important to be protected, not only so that their lives are protected, but because they will overwhelm our healthcare system. So how we do that is something that we need to carefully evaluate, carefully try and see what works. Ultimately, we're going to be living with this virus for months, if not years, and we need to figure out how to do so while minimizing its health impact and minimizing its economic harm as well.
Okay, so we have a couple more questions from the audience, and a lot of people would like to know about this new drug, remdesivir, and whether it's very promising in helping control this virus or responding to it.
It's good news. It's a drug which, if the studies are confirmed, can cut down by about 4 days severe illness in people who are severely ill in the hospital, that maybe will be able to reduce the death rate perhaps by 20, 30%, but it's not a game changer. It doesn't change the fact that we have a terrible pandemic, that many people tragically will die from it, and that it's going to affect our economy for many, many months to come. The only real game changer would be an effective vaccine.
So let's talk about the vaccine for a moment. There's this rule of thumb that it takes at least 18 months to get a good vaccine. I think a lot of people have translated that into 18 months and we're good. What can you talk about how hard it is to develop a vaccine and whether we can expect one in any given time, or are there diseases that are just vaccine resistant?
Well, first off, 18 months is optimistic. We might be able to beat that deadline, but it would be, as Tony Fauci said, a world indoor record for vaccine development. It's usually 3-4 years or more. And as you mentioned, there are some diseases, think AIDS, TB, malaria, that we've been working on a vaccine for decades and don't have one. But there are some hints that coronavirus vaccine might work. We're hopeful it will, and we need to go all in to try to come up with a vaccine. Remember, vaccines are one of the greatest things science has given to society. They've saved hundreds of millions of lives globally, and vaccines would be the game changer in this pandemic.
Okay, and there's some indication that we might have a lot of parents online because there are a lot of questions about whether you think colleges and universities will open in the fall.
Well, I do think universities will open. How they open, it has to be worked out. And I do think the principle of protecting the vulnerable should guide our thinking there. So if there are medically vulnerable students, they may need to continue to do distance learning. But there may be ways to open that are safer: hand sanitizer, face masks, maybe testing, more physical distancing, limiting mass gatherings. All of this is important. We need to get our economy reopened without rekindling the epidemic.
So how do you limit a mask? Is a mass gathering a class of 20 or a class of 300?
Partly it depends on what the physical space is like. Partly it depends on what the crowding is there. But the large lecture classes are an area of concern. That doesn't mean that they're not possible, but it's something that we're going to have to look at very carefully as classes resume in the fall.
Okay, so somebody asked, and I think we've been dancing around this, so I don't know if you can do this. What is the time horizon that everyday people should prepare themselves for?
Well, on the one hand, we're definitely over the worst of this phase of the pandemic in most of the US. So things are getting better, and we can gradually resume some activities. On the other hand, we're getting back not to normal. We're going to get back to a new normal. And that's going to include physical distancing, hand sanitizer, face masks, avoidance of choirs and large gatherings when many people come together in one place. It's going to be particularly hard for some industries: tourism, travel, restaurant. We're going to have to figure out carefully how to resume those activities without causing an explosive increase in cases.
What I really want to know as a final question, because we're running out of time, is can I go to the beach this summer?
Yes. In fact, outdoor places are much safer than indoor places. So okay. Beaches, parks, bicycling, hiking, these are great things to do. They're great for the spirit. And outdoors is a great way to reduce risk. Now, if you have 100,000 people on a little tiny beach, that's a little different. But with sensible precautions, the great outdoors is a great way forward.
Okay, I'm going to stop it there because that's what I wanted to hear. And we're out of time. So Dr. Frieden, thank you so much for being with us today. I really appreciate it.
Thank you, Allison. Thank you, Ruth. And thanks to Aspen and Aspen Ideas and the Spotlight on Health.